Hi, everyone. My name is Monica Moore, and I'm a nurse practitioner and a health coach. I've been in the infertility field, I love it, for over 20 years. And today I want to talk to you about weight and fertility. A little bit of a complicated topic, but one that I feel strongly about. And I want to go over with you what excess in weight can mean, what the issues could be, and importantly, what you can do about it. So why do we care about your weight and fertility? Because there are some consequences. And we know that women who are overweight or obese take longer to conceive naturally, have lower clinical pregnancy rates, lower live birth weights, and higher rates of pregnancy loss in IVF cycles. Also, excess weight in the male partner can be a contributing factor. And when somebody is anovulatory, so they don't ovulate regularly, weight loss has been shown to increase the likelihood of spontaneous pregnancy, so pregnancy without using any methods or medications prior to even undergoing fertility treatments. The issues with excess weight don't stop when trying to conceive. It's also associated with adverse maternal, obstetric, fetal, and pediatric outcomes. So obese women who conceive are at higher risk of adverse pregnancy outcomes such as gestational diabetes, preeclampsia, which is high blood pressure, and stillbirth. Children who are born to obese women are also at risk of congenital abnormalities. And if we think about the fact that the potential baby that we're going to have is actually our patient, I actually think about that as a nurse and a life coach. So not just you or your partner if you have one as a patient, but your potential baby is the patient. So I want to create for you the healthiest environment, and that's the uterine environment for this baby. Because the fetus is incredibly sensitive during periods of growth and differentiation, which is the first 6 weeks of life. So not only is the early uterine environment good in just terms of nourishing the baby, but it actually can alter the gene expression. So it can change genetic expression in the baby and affect the baby's chance of getting susceptible to diseases such as diabetes later in life. So I think we pretty much know all these reasons why people overeat, but this is what makes it so complex and so difficult to deal with, both if you are somebody who has had an issue with excess weight, and for us as your healthcare providers, because we know it's not as simple as calories in, calories out. There's a genetic component, and so everybody has their own unique way of how much energy they expend and how much energy they need. Environment, the food availability is very plentiful. We know that the people that create these foods that taste so good to us do it after years of research, actually research that makes us addicted, for lack of a better word, to salty, fatty, and sugary foods. That's real. They basically find all these formulas to make us want to come back for more. The space for physical activity or the time for physical activity is not always there, especially with, COVID and the virus that we're dealing with now. And then some people don't have safe neighborhoods to exercise outside. There's also people have individual sensitivity to hormones. There's a lot of hormones involved in terms of how much we eat and what we eat. And a few of them I listed here: cortisol, leptin, insulin. Some people are sensitive to them, and some people are very resistant to them. So eating in a way that's healthy, eating when they're hungry and stopping when they're full, is not so clear cut for people who are resistant to these. Psychological, this is a big one that I see as a health coach. People eat for different reasons. Often people use food to solve a problem that food can't solve. This is a big one. So they use food as a coping strategy. For many people, it could be a response to trauma. So excess weight in the brain can be perceived as protective, and to lose the weight might make somebody feel vulnerable. So we explore that a lot when we talk about stressors and coping mechanisms in people's childhoods or formative years. And then social. Eating is a connection, it's community. For those of us in COVID who are separated from our families, we realize the real importance of having community. And sometimes when we're separated from people, having a meal and having that sense of connection is incredibly important to us. So the question is, how much weight do I need to lose if I have excess weight? Well, I'm going to show you some BMI suggestions, but really, it's not a lot in order to make some really positive changes. So most clinicians will just prescribe 5 to 10% of weight loss in order to really positively change some metabolic, some biochemistry outcomes. So I say only 5 to 10%. I know that's still hard, but it's not like you have to get to, for everybody, a certain BMI before you can make a difference. Even losing 5 to 10% for many people can be a big difference. And for a lot of people, that seems surmountable. So what can I do now? In order to make a change, you need to find healthy ways to cope with stress. You need to break the trigger food reward habit. So there's a trigger for people. Let's say for some people, it's stress. Then they use food, they'll eat for stress because eating that food produces, let's say, a sense of calm. So what I help people do, and what I suggest that you do, is if you go into your pantry or cabinet and you go to reach for food that maybe because you're not hungry, for you to stop, just notice it, not to be judgmental, but just acknowledge that and say, what am I feeling right now? Am I feeling hungry? If the answer is yes, then you should eat the food. If the answer is no, then you really have to examine either what are you feeling that you don't want to feel anymore, or what is the feeling that you're trying to create with the food? And then you want to replace then that eating of the food with a healthy habit. One of my other tips is not to engage in fad diets. A lot of people that do these meal replacement programs, the shakes, and they end up losing weight quickly, that weight is often not sustainable. Not only that, but it might make an outside weight change and it might make a change on the scale, but inside, the hormones, what's going on at the level of the ovaries and the uterus, that may still be not positively affected in a short period of time. So a lot of studies that are coming out now are starting to show that drastic weight loss in a short period of time may actually not be helpful and is not sustainable. A lot of these people gain the same amount of weight back or more. I tell people a lot, which is sort of a continuation from the last slide, to emphasize making your insides healthy, because that's the part the baby's going to see, right? The baby's not looking at your outside, not experiencing that. What we want is your inside to be healthy. We need that really a good mind-body connection, and we work on that a lot. You need to have some kind of form of stress release so that you don't use food. When you're having an infertility journey, often many people have a glass of wine or a drink as stress release, and obviously we're kind of taking that away from you because you're planning on pregnancy. So we're taking away some of your coping strategies, and then we're making you stressed by the infertility journey itself. So really explore what forms of stress relief work for you. I also tell people to try to make their diet between 80 and 85% of healthy whole foods, so not processed foods. But importantly, not perfect. We're not trying to eat 100% of the time the same way. We're trying to eat most of the time those healthy, not processed foods. I do tell people that this mostly means going to the refrigerator instead of the pantry or cabinet. Often those things that are in your pantry or cabinet are in there and can stay there because they have a lot of preservatives and a lot of additives that are probably not healthy that keep them in there and unfortunately make them taste good. But if you can make the bulk of your diet to be healthy whole foods, and afterwards if you want to have question and answer with me, I'm happy to go over with you what some of these would be. That's important. Getting good sleep, I can't emphasize this enough. Even just a few nights of poor sleep can really, really negatively affect you the following day. It can make you feel like you're hungry when you're not. It can make you feel like you're never full. It can make you feel cranky, and then you reach for food for emotional support. As we discussed, that doesn't work. So really working on good sleep habits. Establish a regular movement practice. Notice I didn't say exercise. I actually don't use the word exercise with my clients either, because that has a connotation of you need to have a planned exercise class. You need to have a planned exercise outfit. But frankly, just moving often and moving on a regular basis with at least 5 days a week, but if not most days, can make a huge difference in a lot of metabolic parameters in your body and really in how you feel. So I always tell people to not only increase their activity, but to decrease their inactivity. So in this case, fidgeting is good. So if you feel like you're sitting in a chair for a long time, stand up when you make a couple calls. Walk around and pace when you do things. Sit on the floor sometimes so that you use your big muscles to keep you upright. All of these little things that you can implement into your regular day can make a big difference in terms of releasing feel-good hormones and increasing muscle mass that then will increase your basal metabolic rate, or how many calories your body uses just to exist. And finally, it's so important to play, be creative, and have fun. Infertility journeys can be incredibly stressful, as we know. Then if we layer on top of it the fact that you need to do all of these things in order to lose weight, be healthy, and none of them feel fun, not only they're going to be not sustainable, they're just going to feel like one more thing that you need to do. So I really, really emphasize doing things that are fun and playful and creative. And if that means throwing a Frisbee as your form of movement that day, that's great. Then you can go throw a Frisbee. If that means journaling, if that means, doing some art as your form of stress release, incorporating that sense of playfulness in studies has been shown to really help in terms of mental pressure or stress. I think a lot of us probably feel like this donut right here where it says find your center, and we feel like we don't know where our center is. We've lost our center. Maybe we never had a center. But a mindfulness practice, I know that the word mindfulness is sort of all the rage, and everybody's like, what does that mean? There's a ton of apps out there. I'm happy to recommend some for you. Some that I use, some that I recommend to people. Many are free, easily available, but really just a regular noticing practice. Noticing your outer world, and very, very importantly, noticing your inner world. What are you saying to yourself? What are the stories that you're telling yourself? We can be so hard on ourselves, so much harder than we would be on someone else. And not only does that not help and make us feel bad about ourselves, but it puts us in this state, our nervous system in this state called fight or flight, where we don't digest our food, where we produce excess cortisol and insulin, and those things cause an excess in fat, or can help increase the amount of belly fat. Mindfulness calms and resets the nervous system. It improves your capacity to respond to stress, and therefore it can reduce the chance of emotional overeating. So this is a very short tidbit on weight and fertility. It is absolutely my passion to be talking about how to nourish yourself in preparation for pregnancy or any kind of infertility journey, or both. I'm so happy to talk to you afterwards and give you some tips and techniques and strategies that I use for my clients, some sample snack arrangements or options for snacks that you can do. That I like a certain formula of what people should eat on their plate that helps reduce the negative hormones and increase the good hormones. I do want you to remember, though, that although weight is important in reproduction, it is simply a number on a scale. I really don't like when people kind of compare themselves to some external thing, and the only thing that makes them feel better is if they've worked really hard towards something and the number goes down on the scale. So if all of these other things that we talked about today, your sleep is better, your weight goes down just by a little bit, but your nutrition is better, your form of stress release is better, then that is a win. Achieving a holistic, and by that I mean body and mind, I strongly feel like you can't separate them, lifestyle, to make your inner health as ideal as possible is of the utmost importance. So incredibly important. And interestingly, what I find is when people really focus on their insides and what's best for them on the inside, how they feel best being nourished, and I don't just mean eating, but all the stuff that comes with it. A lot of the time, the outsides end up being reduced in BMI as well, just as a consequence of really making your inner self really strong. So again, my name is Monica Moore, and I'm really happy for all of you guys to be part of this expo. I'm happy to give you this like short little teeny tiny tidbit of information about weight and fertility, and happy to talk to you afterwards. Thanks so much.